all of this. But the most important thing is that we are updating the contextualization of the second victims to include not only clinical errors, as well other highly stressful events in a daily basis are occurring in our institutions. It's inherent part of the activity of the clinical activity for nurses, pharmacists, physicians, and other workers in the healthcare sector. But all are because we are commitment with the quality of care. So our commitment is with the patient. Of course, we want the well-being of professionals, but the problem is not if the professional is trying or not. The problem is that professionals that don't feel able to provide care usually put in risk the patients. So our target is the basic. This is clear. And this is the model in which we are creating, and now we'll be releasing in the policy statement, in which we define the vicious circle of life. If the professionals are not able to provide care, usually defensive practice of other maluse of the resources occur. And in this case, we put in risk the patients. So this is the circle. This is not only because adverse events, it's because a torpid evolution of the patients. So we are asking me what happened. I made the right decisions. I must do a new test to change the treatment to a more ago and different situation. And it's the same in the case of near misses or in the case of violence against professionals. There are stressful situations in which my practice changes. If my practice changes, I'm put in risk the patient. This is the same. So resilience and the model that we are developing, the communication lead by the organization, for example, explain that that we need to introduce prevention measures and self-care as well to ensure that the well-being of professionals is working. So we need to change our focus and to open a debate about how it's possible to introduce prevention and other states to ensure that professionals are able to provide quality of care. Of course, surviving and living are the most important barriers, and we need to face with them. And this is a very, very difficult, because psychological safety, as you know, is not the most common attitude among professionals. Many times I prefer the silence to speak up. This is absolutely clear, because I know that in the past, my colleague who make a mistake within many months was signed by the team, by the managers, by the society as well. Yes. So I prefer silence, hiding the problem. So in many hospitals, I don't know in your countries, but I know that in some countries, the equipment includes carpets, because it's perfect, carpets are perfect to hide problems. So you must review in your hospital if the managers are buying carpets. In this case, the blame culture is the most common culture. So we need to avoid buying carpets. So we need to think in other things. This is the reason of this action. So our results in a summary. Well, I think that we can be proud because in some manner we have contributed to increase a general awareness about this problem. And we provide a platform, for example, the SEP tools. I don't know, Pablo is here to not now, okay? Well, we can talk about. We are advancing in the conceptualization, honest mistakes, second victims, and other critical concepts. We are provide a model to describe the intervention. Sophia Okay, Sophia, you want to explain about your work identifying critical aspects for the support interventions, the model, the critical key points for substance and some other, because she leads a work reviewing literature, reviewing programs, and to identify specific criteria that are useful, and also a metric to assess what happened, really what happened with this type of interventions. So please.
Yeah, so we made a scoping review and.
Sorry, Sophia, just for courtesy with our colleagues online, if you are talking from here, I think it's better for them.
Okay. Can you hear me? Online? Yes, perfect. So we made a scoping review. And we create a formula using the acronym. The name is OPERA, and this is an acronym that we found different type of factors like people, environment, organizational factors. The other one is recommendations from the other studies as well, because we wanted also to see what the other interventions also recommend. So this type of elements we collected and we tried to give to the future interventions and also to the ones that already implemented the interventions, the resources that they should have, like what kind of people, what kind of leaders are, for example, one of the main things was the involvement of the leaders. They want this active involvement, they need to be there. So these are some of the recommendations. So yeah, in this study, we try to use the key factors that people for future interventions, mostly, and also like the current ones, to improve and to create effective interventions, and also thinking about sustainability. So I think this was
Thank you.
short.
Thank you so much. So this is an example of the activities that we are trying to conduct. Well, our scope comes from the frequency of this phenomenon to propose solution to face with this problem. And one of the aspects that we also include is not new, because Susanna in the past was working on it, but we are identifying what is the frequency and the causes and solution as well, because students are as well of the second victim group, because they are in their practice face to face with patients, and sometimes it will grow. So if you want to talk about the students at second victims.
Okay, thank you. This is Susanna Tella from Finland. And yes, I did in my PhD, I was doing a study comparing Finnish and British nursing students' experiences about learning about patient safety. And one part was that we were collecting important learning events about patient safety. And we used this kind of critical incident technique. So we asked them to describe an event that was meaningful for them, either positive or negative by nature. So second victim phenomenon was found there in those experiences. But also what was very important was that if there was a mistake or near miss, if the patient didn't suffer, the student didn't either suffer so much, and it was actually a good learning experience for them, emphasizing the importance of patient safety. So there were kind of positive things in these events that they described. But yes, it was really interesting. And after that, we had this kind of 5-country research project, and we developed this tool, learning event recording tool, so that it's in 5 different languages, and students, different disciplinary students, social care students, nurses, doctors, physiotherapists, and any can describe about their learning experiences. And my kind of wish and view and hope is that we could someday analyze those with AI, so that we could see, for example, a medication mistake from different point of view, what it means for different multidisciplinary students, but maybe we do also that in real life. But of course, these were from real life, but I mean professionals and those who are working. Thank you.
Thank you so much, Susanna. Yes, the interprofessional training is one of the challenges. This is clear for all of us. But I would like to use this time to invite you because many of you are directly related to working in the academic sector. So we identify many gaps, training in patient safety and particularly in second victims, our students. So this network can be an opportunity to try to change this reality because in our syllabus, in our activities, organized in a workshop or whatever, we think that it's very important that the future generation of healthcare workers are aware about this type of situation because, as you know, this is not a real situation. This is the most common situation in the career of any healthcare provider. So this is an opportunity to think what we can do when back to our institutions, and it is possible to organize using the materials because later Sophia can explain us about what are available in terms of podcast, video, printing materials and others that are absolutely free and available for any of you. So it's possible to think to organize. Of course, we know that the language may be a barrier, but currently there are Portuguese, there are German and Spanish, and there are other languages coming soon. And I invite you that if you think that this is a good opportunity, we can translate into different languages as well, all the materials. We are using a very simple procedure. We use artificial intelligence for the first translation. So in less than 30 minutes, you translate all, and then it's needed to review step by step because sometimes artificial intelligence introduce some mistakes and it's needed, but it's useful for videos, it's useful for podcasts, it's useful for many things. We don't need to hire a specific actor of voices because using artificial intelligence is possible a good result in different languages, but we need to ensure that the translation is right. This is the point. So in this case, we have produced some paper in top journals. Today, Rainer explained us the last one. And I think that in no more than some days, we received, because this morning as well, we received the secondary review. And today there are minor comments for the last paper that we organize as network. So we are very happy. But these are samples related advances in the conceptualization, in the suggestion for interventions, metrics, analyzing what happened in the academic sector, the impact on legal scheme in our countries. This is one of the challenges. Sandra and Naf later explain more about this point. So we have 2 white papers and different publications in a scientific journal. So at the end, we produce a lot of things. So I think it's a very good news for all. And of course, there are these self-paced course that is available for all. The only is that you must decide how to use all these materials. So it's in your hands to promote and disseminate the information about the second victims. Some of you saw this video yesterday, or are coming today. This is a summary, this is a draft. We are working to improve the final version of this video. This video was produced just to disseminate a general audience what second victim is and what is the problem and what is the impact and why we are working on it. So this is a very summary, yes. We have a problem because I need to change the. Yes, a moment, sorry. Pero voy a comprobar. Just a moment. just in case our colleagues online. Okay, now they can.
The European Consortium for the Study of the Second Victims Phenomenon, ERNST, has led Action 19,113 over the past 4 years.
Sorry.
The European Consortium for the Study of the Second Victims Phenomenon, ERNST, has led Action 19,113 over the past 4 years. This action, funded by COST, European Cooperation for Science and Technology, aims to improve patient safety by emphasizing that the emotional well-being of healthcare professionals is a prerequisite for quality care. ERNST has extended the concept of the second victim to all professionals in healthcare and social care institutions, addressing a range of traumatic situations they face in their work, such as resuscitations, patients not responding to treatment, lack of resources, care pressure, fatigue, or systemic failures that could lead to human error. These highly stressful and common situations in clinical practice lead to burnout, defensive practices, and disillusionment, which put patients at risk of experiencing adverse events. ERNST integrates a broad multidisciplinary team with researchers from Europe, the United States, Canada, Japan, and Latin America, aiming to strengthen the resilience of professionals to achieve better professional practice and better health outcomes for patients. In the course of its work, it has developed a 5-stage intervention model that includes actions aimed at prevention and self-care, along with peer support intervention for second victims. The research has built on the most successful support experiences and identified the critical factors for the success of these emotional support interventions. Additionally, it has defined by consensus of a large number of professionals from 12 different countries, a total of 11 essential indicators to monitor and improve the implementation of these support programs for second victims. The intervention process, to be effective, must be carried out by peers, professionals who are well acquainted with the work dynamics in the various services and units of healthcare centers, and who have experienced being second victims. However, in addition to that experience, they need skills in communication and counseling. In this action, we have identified the competencies, communication skills, interviewing and counseling knowledge, and attitudes that these peers must possess, advancing the training of these professionals essential for support programs. Through this joint and multidisciplinary work, we have generated educational materials, typical situations, podcasts, case studies, and made them available to health systems, institutions, and professionals. More than 2,000 European healthcare professionals have already completed the ERNST online course, available in several languages. ERNST has agreed on an institutional declaration endorsed by 31 countries, describing the impact of the second victim phenomenon on patient safety and the healthcare system itself, which has been presented to the highest authorities of the European Parliament.
So I suppose that no later than 2 weeks, this video is available in our platform. And of course, we prepared this video thinking that you are happy to use and to disseminate. I think it's a funny manner to disseminate the knowledge. And of course, any suggestion, we have time to improve this type of materials. So please feel absolutely free to suggest whatever and to think. Well, as you know, we attended the definition. I think this is a critical point because many times, as you know, the term victims is a barrier to talk with the society about this phenomenon, because in some cases, maybe exists some misunderstanding about the meaning. This is, I repeat, the target is the patient, it's not the professional itself. But I think it's very important to recognize that there are highly stressful events in the basis day, in the practical, in our institutions. So we need to face with this problem. Really, nobody has been able to suggest an alternative term, moral distress, and other are close, but there are different meanings. So the most typical term is second victims across the world, but really the term victim sometimes is a barrier. I recognize that it's clear that we need to explain what we use this term in many countries, in many situations, but really I think that the definition that our network is able to produce is contributing with a solution of this problem. The frequency is showing that this is not a real event. This is the most common thing. And if you are working in the healthcare sector during your career, you're a second victim as well. This is not it's not possible to avoid this type of phenomenon. So it's very common. And we have some ideas about what happens if we don't face with this phenomenon. The first is, I repeat, we put in risk the patients. This is the most common risk. And the second, Rainer and his team was analyzing what is the situation, for example, in Germany, and the cost effectiveness of intervention program is clear. Professor Pu and his team in Baltimore as well some years ago analyzed the cost of the intervention and the benefits in economic terms of this type of intervention. And now in Europe, we have also data that support the idea that this type of intervention is cost effective. And we need to explain to the managers, to the top of the patient safety agency and other stakeholders this information, because we need to think if these interventions are good for us or not. So these are arguments in favor of this type of intervention. And of course, we need to think how to face. In this case, we developed this 5-tier model, and we are working to introduce this model in our institution. In this sense, the work that led by Sofia is an example to identify key aspects. Also, we conducted a study with the leaders of the European intervention programs, Woody, Woki, the program in Netherlands, Belgium, as well in Spain, to identify key aspects, and a white paper describing the critical key success factors is being published as well. So I think this is very useful information for who are interested and are working, developing this type of intervention. Our intention is to support any programs in any country that want to put in practice, and the idea is to connect leaders with experience in different institutions to support others. The idea is to promote that this network is useful for many people, and to use the knowledge and experience that our leaders introducing this type of programs to support in other countries. So feel free as well to share your initiative, your worries, your questions, because we are trying to support each other to advance in Europe to face with this phenomenon. Of course, this is the course. There are some languages that are coming soon, but of course, if any of you are ready to translate, well, we invite you to be energy and to use. And maybe, Paulo, you want to describe some aspects about the schools or whatever?
Well, this course was developed by a group of 18 international experts. It's available online, so it's for free. And those who finish with success can upload a certificate. And yeah, it's based on lots of evidence and case studies that were developed by our group. And it is very interesting for you to know, in the last months, more than 2,000 applicants applied to the course. So this, I think, it's a signal of the interest and success of the course. So we invite you all to to the course and to spread the word to your colleagues. Okay, thank you.
Thank you, Paulo. Well, this course, based on the Spanish regulation, recognize credit. So from yesterday to the last day of December, all the participants following this course receive an official diploma recognizing European credits. The question is, this is information that you can use to spread the word as well, please. If you did the course before, we are opening a special procedure to recognize your efforts. So the people, these 2,000 people that want to receive the diploma is possible using a specific procedure. And if you are a new participant from today, there is not any problem because you are under the umbrella of this type of recognition.
Yes, sorry, one last minute news that we agree with Michel to translate into French. So we'll have French in a couple of months.
Thank you so much. Good. So, well, in any case, thank you so much. This is absolutely free. Remember, our activities are non-profit activities, and we are very happy if you go ahead and use and translate or whatever. So this is the sample that Sophia explained before, and we are working as well because the individual level is needed, of course, but we need to introduce as well change in the culture of our institutions. As you know, the formal basing approach is retained in many institutions. That's common in the past. We are advancing in the patient safety culture. This is clear for many countries, many institutions, but clearly, secondary care intervention needs that something is changed at organizational level. So the blame culture is the most important barrier to introduce this type of programs. Because, for a very simple question, because professionals prefer silence than to speak with others about what happened. So we need to advance. In this sense, our policy statement is describing the situation, some recommendations, and we are working to imitate the European Safe Aviation Law, because this law recognizes that professionals can do mistakes and identify and use the term honest mistake in line with the just culture principles to understand what happened and to provide some solutions. In this case, for the airlines, it's like mandatory to support professionals who make mistakes and to ensure the well-being of the pilots and other professionals working in the airlines to ensure that passengers are safe. So it's in some manner, there are some similarities with the healthcare sector. So we are working on it as well. Well, some tips about our work. Well, this is clear. We are meeting in different countries, in different situations. So thank you so much for your commitment to choose to come to the activities that we are organizing. We are very happy because our colleagues from Romania, from Germany, for Croatia, for many other, Portugal as well, are organizing activities. In Poland, we meet there as well, and it was a very good opportunity to meet with you, but also to learn about your experience, about your country, and to know more about other manners to organize the healthcare system, to know more about hospital. All of us were impressed about the hospital in Vienna, if you remember. It's like it was amazing. Chairs, sofa, market there, so was incredible. And it's was a very relevant experience during the training school. We learned a lot, so thank you so much. Well, we have some materials, case studies, and others. So all these materials are absolutely available on the platform, on the website. So if you need to use, don't worry about, you can use it anytime. Of course, all is in English. So if you need to translate, we can support you in some manner, but there is no funds for translation. This is clear, following the course rules. But it's simple, and we are able to support you with the videos, with the podcasts, or whatever you need. Well, if you want to explain something about the podcast, or yes, please.
I can explain that we have this podcast that is available in more than 10 platforms. You can reach in Spotify, in SoundCloud, in different type of platforms. And also in the website of the ERNST, we have one section for podcasts, so it's also easy to find. And you have different formats. You have like really short podcasts if you want to just have an overview, but we also have podcasts with 1 hour. It depends. It depends also of the format of the conversation, what was our main focus, because that we have 10 minutes of duration, because they support the training school. And they were a support resource for explaining the main gaps of the implementation, the main strength. So this is one of also the main issues here in the podcast. But feel free to ask if you need some help in finding more information about the podcast. But I think it's really easy. You just have to put a Second Victim podcast in the internet, and it's the first. You will find a lot of different platforms.
Okay, thank you, Sophia. Thank you so much. So all is available, so you can use it anytime. Of course, there are some pressures. You can imitate or copy paste in your language or whatever you need. You need some pictures, so to build a different brochure, feel free, don't hesitate to write, and all is available, so don't worry about it. And these are samples before till this 5 and last for this action forum, more than 2,000 participants, so it's a great number. So we can be happy about this situation. Of course, the tiny school as well, a higher number of participants. Sorry if in some cases was not possible to attend your application. We try to involve as much as possible, but the limit is the funds. But I think that nobody was out, so well, and they are near to 300 trainees, so I think it's great as well. And well, in all cases, this is a good thing. Well, there are people from many countries, so this is also a good news. And of course, the grants, source space, is more important because it's very short time. It's 1 week, in some cases 2 weeks, but really was very productive, because in many cases it's the origin of new studies, new publication, new researches. So I think we use in a very good manner this type of tool from COST. And they are in many countries. Some of you are visiting other colleagues, and now it's a very good opportunity for us to know more. And of course, we have the website. Well, 300,000 visits is, well, it's not so amazing, but it's a very good number. So I think we can be happy as well. Well, 21 paper published. So directly with the targets of this action. This is not the production of the members of the network, of course. They are specifically related with the targets. So I think it's a very good number as well. So congratulations to all. These are examples as well of studies not included in this 21, because are studied very related because you are the authors, but of course are working on security in all of them, but are not directly related with the targets of the action. Are studies that you are conducting in your countries, some of them in international collaboration. So they are also very interesting in Croatia, in Spain, in Germany, in Lithuania as well, in Serbia, in different countries. As well in Colombia and others. This action is not directly, but in some manner directly responsible that in some countries, for example, this manual from Colombia, we promote and support that this type of materials and initiatives was created in this country. And there are some other examples in Europe. I don't know if any of you want the microphone to explain the experiences, feel free to use. But really, we are promoting in some countries that the awareness about security phenomenon is growing. So I think it's a very good point as well. And of course, our colleague Sandra introduced the policy statement, our policy statement, directly to the President of the European Parliament. So this is a height in our short history, but it's a very relevant because we get the maximum level in the European institutions. And to open a debate about this typical problem, I think is very relevant because, as you know, we have 1 year more for a new project rescue. So this is a very good opportunity to introduce our proposal at the European level. And of course, the last but not minor relevant is that we are happy because, as you know, one of the most difficult problems in any project, international or national level, is how to ensure the sustainability when the funds are on. And we are very happy because we have approved our proposal for 1 year more. There are only 6 actions from a total of an amazing number. So we are very proud and happy. And the rescue program with other 5 were selected by COS to be funded for 1 year more with one objective: to transfer to the practical, to the real world, all the knowledge that we are producing during the last 4 years. So the target is clear. Just to, it's clear, but we need to transfer to the real world our experience. This is the challenge, and we are working in this project. At the end of this forum, where we, Reina and me, try to introduce this new project for a global information. But from now, we are inviting you to participate in this new project, like now with the previous. So I am happy to say that from the 1st of November, the new project will start. So thank you so much. I don't know if there is any question, any comment, any other information. Nazareth, I need your hand if there are any comments on the chat or whatever. So I don't know if there are any questions, any doubt, any comment, any suggestion, any opinion about the action, nothing to say. Remember, this is the last one. So if you be silent, okay, Elena and Susana. Thank you. Yes.
So thank you so much for the overall presentation of your success within the cost action on second victims. So I would not say this is the last time because I see that you have started a lot and that you have initiated in many ways the awareness rising among students, among professionals, among marketing in
public, so I would say this is the last time. Maybe it is the good time for me to say thank you so much. I was very happy. Really, I don't know, it might be some lucky star that hit me on the day when I met you and asked you if you were available to come to Serbia. So and of course I will be supporting all your initiatives with my colleagues, and hope to be part of this success, which is, I would say, infectious. I feel really impacted now with your success, and my congratulations to all of you. And I think topic, second big thing, is a long term.
Thank you, Sebastian. Well, I appreciate very much your words, but really this is a word in a friendly manner. But I think that we are working a lot together, and if you remember, the 2 first years was the period that we need to forget. That was a very important period for all of us. But at the end, I think that we can produce many aspects. We pay attention to many relevant factors affecting the challenge, as you described, is huge, but at the same time, it's very motivating. So I think that well, the most important thing is that all as a network can be faced with this challenge in some manner. So I think that we are able to conclude in a happy manner this new project that we have. Yesterday, I say you that this forum was organized to say bye-bye, as you remember, because this action really is over. But at the same time, we change bye-bye, well, hello again. So we can, we have the opportunity to work together. And of course, independent of the action, I think that today we reinforce our collaboration. So with or without any action, we are able to work together. Susanna, please.
Okay, thank you. Just from a communication and dissemination point of view, I just want to remind that this has been very, very successful, like Jose just described. This has been research to public, this has been research to researchers, this has been research to social media and media, and also research to policymakers. That is kind of for European projects, maybe the main target. So this has been very successful.
No, thank you so much. This is very, very relevant because I suppose that you have a similar experience. You told me in the past that I'm sure that we are able to prepare a paper because you are familiar with this type of task. I be sure that you are able to prepare a new proposal at national or international level because it's in your hands and you are familiar as well. But to get the policymaker, the high level of policymakers, I be sure as well that it's not simple because it's a very relevant challenge. And many of us are not familiar with this type of task. But in this case, in this action as well, we were able to get this level, and now we have the challenge to reinforce this relationship to get change, because this is our target.
This is useful.
So first of all, I want to thank you, because you have achieved a lot. And I want to highlight one thing, that's the definition of the second term. For me, that's a milestone, because it clearly says directly or indirectly. It includes also the observer, the incident, and the healthcare worker, and it also says negatively impacted instead of traumatized, which for me is a huge thing, because I often discuss with psychologists, and that's the term, I don't know if you know it, secondary traumatization. And now I can say that there is a difference, and it makes things so much easier with this definition. And so for that, I really want to thank you and spread it. Please spread the correct definitions
Thank you so much. Yes, I fully agree with you. I think that the work that our colleagues from the working group number two, Chris, who lead by Chris, Maximiliano, and Deborah, is great because, well, I think open eyes about the problem. Of course, the trend was created many years ago and in a very good vision about the problem, but 20 years later, we need to think about and to, because many of the programs under the umbrella of second victims really are included support to other things that are best friends. So this is the group reality in which we are working and we need to face with the actually problem. And in this sense, I think that in some manner, this action is contributing for a more clear understanding about the problems that we have. So thank you so much, Eva, for your contributions. Well, I don't know, is there any other question? Yes.
Short one and maybe silly thing. Thank you for on this related to the video. I got the opportunity to see it twice, and now so I came in this small observation. Maybe someone working in healthcare related might have some public reviews of those that are.
Oh, okay.
So since this second victim part of maybe
Okay, thank you so much. No, any observation about, you think that this is for a general audience, it's not for a specific and training audience only, but I appreciate very much any comment because we need to improve and we were able to identify some typical pictures that are not right, but maybe some is needed to be reviewed. So thank you.
So the folder of Sandra is empty.
European Specialist Medicine Organization. I am there. And we will
I'm going to put in Sandra.
we already have a capacity. This one doesn't want to place. And we are preparing some other activities going to go through the next conference. As well as
Okay, thank you so much. I appreciate very much. I'm sure all our colleagues, your initiative and this type of work, because it's one of our targets, because we are not able to reach out all Europe, all scientific societies, all healthcare institutions, so it's in your hands to transfer. Usually during the last day, the last session in the training school, we use the term ambassadors. So we would like to invite you to be ambassadors of this action. So in the nurses, the scientific society, pharmacists, scientific society, and one of the advantages as well of the definition is not restricted to physicians and nurses, because there are other workers as well in our healthcare institutions. So we need to organize and to think that we need to face with the problem that we actually have. And this is initiative and others are very useful. Reynard and other colleagues with Susan School in some weeks are participating in Colombia as well in a nursing forum to spread the word about the second victim. So these are many examples of their critical mass that need not be moved. In many countries, second victims is not a recognized term, but I am sure that you have the same experience than me. In the first 5 minutes talking about second victims, you can understand any speaker perfectly. Maybe we don't use the term second victims, but we have the experience of second victims. So it's not a problem for a complete understanding of the situation. I think this is a strong point to introduce what is possible to face with this phenomenon. Well, thank you. I don't know, is there any other comments, suggestions? So it's the time to change to other speakers. Now, I think it's vote. Okay? Yes, thank you. I think that, yes, is that because it's not good connected to the system. Thank you.
Thank you, sir. Thank you.
Who is going to
Good morning.
present, so the presentation?
First of all, let me congratulate Marina for
Thank you.
for this organization. It's perfect organization. The second point, I will invite you all to stand up, because if we are talking about health workers, health and well-being, I think you are seated for 1 hour, more or less, so you should do some stretch and exercise, because it's good also for our health, with the participants here in this conference. And this gave me time to extend my presentation. Well, my role here is just to give.
Hello, Marina, can you hear us? We don't have any audio from you, from the room. Sorry, I'm trying to call Marina or Jose. Hola, ¿me oyes? Hola, que no podemos, o sea, se ha silenciado el audio y tampoco vemos la presentación. Es que creo que José se ha salido de la llamada de Zoom. Y solicito para reactivar el audio.
And share the screen.
Vale, lo que no vemos ahora es la presentación.
Share the screen. Yeah.
As someone
Ahora
said,
sí,
this
gracias.
topic very contagious. I think it was Professor Milena. And in fact, once we are touched by the topic of second victim, we get a chronic disease, which is a good thing in this case. But I was saying that there are lots of evidence that show us that adequate training ensures that peer support are not capable of performing specific tasks, which means skills, but also they are embodied to the values and qualities, which means competencies. And these competencies and these skills are necessary and crucial for improve the peer support programs. We know that to develop and enhance both skills and competencies, training and education play a fundamental role. And these link us to the importance that some organizations could or should have in this area. And we are talking about the governments, the academic institutions, but also the professional associations, chambers, etc. And scientific societies are very important. We also know that in terms of the main international organizations that are dealing with quality and patient safety, they all have already highlighted the importance of support of healthcare professionals. I will give you just some examples. As you know, the Global Patient Safety Action Plan 2021-2013 is the strategic plan that the WHO developed and that should be implemented and adopted by all nations. You see, they define 7 strategic objectives, and one of them, the number 5, is directly related to healthcare workers, education, and well-being. Also, I think it was Reinhard already mentioned this in the morning. In 2020, the WHO presented the Health Worker Safety Charter, which is a very important document, and it was presented on the celebration of the World Patient Safety Day, which is celebrated on September 17, with the topic of health worker safety, a priority to patient safety. If we have any doubts among the both concepts, I think now is clear due to the efforts of these international associations. Also, the OECD have published some working papers related to safety in the world, in the healthcare settings. Also, the Joint Commission, as you know, is one of the most important accreditation body, an international agency. In the recent years, has stated several safety actions for support taken victims, and they highlighted the importance of the peer-to-peer emotional support and also what they call the buddy programs. Very important, the United Nations Agenda for 2013, based on the 17 Sustainable Development Goals. One of them is specific dedicated to good health and well-being, and one of the targets is specific for healthcare workers force strength. And the universal health coverage, as you know, is one of the goals that all health systems should pursue. And you should bear in mind that this is not only about access to patients, but also about ensuring healthcare workers that have resources, supports, and work conditions necessary to provide safety care and care with quality. So, saying this, the main message that I would like that you all take home is that health and well-being of the healthcare workers is directly related to patient safety. Without further ado, I will now pass the word to the expert on the topic, Jose. That is not. There. So, Jose, thank you very much for inviting me. It was a pleasure to share this couple of minutes on the stage with you. Okay, thank you.
Thank you, Max. Thank you for this. Well, one small group led by Paulo as well is working about the competencies, the skills that the supporters need. So, as explained, we are reviewing the literature as well. We are asking leaders of the programs in Europe, identifying communication skills and others that basically are the core for the training. And this information is good for this action, but is particularly relevant for the next action. Because, as you know, the new one is for the certification of the peer supporters. And in this case, one of the most important things is to identify the skill that they need, and also to identify how they are acquiring this type of skills. So we are working in this direction. Our intention is double. First, the certification, and second, to support other initiatives that are preparing programs for training peers. In this case, a list of criteria of minimum skill required is needed to organize the programs, the targets, and to identify trainers and so on. So we hope that this type of initiatives are useful for them. Publication comparing all this information was submitted 3 or 4 weeks ago. So we need to wait to share, I hope, good news. But as you know, this procedure to review a new paper usually is more than 6 months. So we need to, in any case, we have a very useful list of competences. Is also, of course, available for any of you who want to know more about this type of approach. So in any case, feel free to write to Paulo, to me, or Nazaret as well, asking if you need in advance this type of information. But really, there is a list about aptitude, it's about notion, it's about experience, it's about basically about basic communication skills. We identified as well in many programs that a recognition of trust on this type of fields is absolutely needed as well. It's not only referring about instrumental competences, it's about the view of these professionals among other colleagues in the hospitals, in the primary care or others. So I think this is a complete list of competences and requirements that this type of peers need to ensure that the activity is right. So feel free to ask any time to asking about this type of stuff. Okay. So any questions, any comments, or we have some experience because from Mexico as well asked us for trained peers in a biggest hospital there. So there is a movement behind all this action, and from different parts of the world there are very good initiatives implanting this type of program. So we are one of the necessities of this type of program. Yes, yes.
Because before you started, or maybe we started at the same time on different villages or towns. I started in Austria to get everybody together who has an intervention program. And then I realized it's really difficult because one intervention program is 8 hours course, another course is 9 days. So then the discussion starts. My course is better than your course, and we are better, and we use this model, and you use this model. So that's what I said. There is that we have to have minimum criteria. If somebody wants to have a, I don't know, 14 days course, fair enough, but we need to get the healthcare workers 14 days off, so it should be applicable as well. And so I'm really happy that we have rescue, which helps a lot.
Maybe it's a nice one, yes. Well, really, this is a human response, not only for your country. I think it's very common. And in this case, well, we have some experience because it's like others. We need to share and to define criteria. I think it's the best manner to advance because otherwise it's impossible to define. And well, I understand that there are some masters about it, but maybe we don't need this type of training. We need to identify a minimum that is needed because otherwise it's not possible the sustainability of this type of programs in many countries. So we need to be practical. This is clear. But the future is certain. So we need to wait. In any case, I think that we are in the right path. Okay, thank you so much for your contribution. I don't know, is there any other questions? So, sorry.
Regarding the trainings, maybe we have a different, let's say, audiences. So this is the bottom-up approach that the pathway that you are building. So making colleagues competent to provide peer support in these critical incidents events. And on the other side, I was thinking, is it possible to make maybe not a course, maybe not a trade, let's say an advocacy tool for managers.
Yes.
How to improve their, let's say, their competencies, their skills in creating the supportive organizational environment. So it might not be as long as 9 weeks because it takes a lot of time. But maybe you have been doing something about that. Please share with us. Thank you.
No, thank you so much, Nina, because this is a critical question. Really, they are practically across Europe, not only across Europe, I think around the world, but particularly in Europe, there are two strategies, bottom up, top down. In many cases, bottom up is very useful, but there are very good examples as well that is a strategic decision at the higher level and is impregnating the whole organization. But really, maybe the bottom up is the most common, but not the only one. I think that is a very good recommendation, a very good suggestion to think about managers. In Spain, I think 10 years ago, more or less, we started with our home ministry, a specific workshop with the top managers of our institutions to explain the concept, to explain the meaning, and to introduce what is possible to do. So I think that there are some examples. It's the same in other countries. In other countries, like Eva can explain, the health ministry is as well implicated to find solution alternatives and some solution. In Finland, I think that second bit is included as well in the basic safety strategy. It's the same in Spain and other countries. So I think it's very, very relevant, your comment, because we thought that managers is not possible to introduce. If you remember the figure in which we are talking about organizational aspects, the basic safety culture is not only responsibility of the managers, of course, it's a responsibility of us, but it's clear that it's one of the responsibilities of the top level of the organization to care these aspects. So I think it's a good point, Paulo and Sofia, to think about it is possible to organize something a little, because this is clear. If we are organizing a training school for providers, workers, and so on, 3 days and a half, maybe it's possible. If we organize it for managers, half day is enough. So we need, because they haven't time. So we need to organize in some manner and think about, because it's very, very relevant. Okay, thank you.
Saskia, question. When we talk about managers, which level? Because there are different levels, and I have to say that when I met the director of nursing from the hospital where I work, he said to me, you know, we really want to support our nurses, our people for what they do, but there is a huge distance. I don't know who you are. I don't know what you're doing. I'm probably referring to the middle management, because the higher management, I am the basis. We don't know them, they don't know us. So
this is a good point. Yes. Well, is open to any who wants to answer, to describe experiences as well. So feel free to ask for the microphone. I fully agree with you. There are 2 levels, clearly. Middle managers are critical, because in any department that the head of this department, this middle manager, is against any evolution of the culture or whatever, it's not possible to introduce anything. In the first column, when we are talking about the plain culture, the traditional approach, and so on, the last box explain that it's not possible to introduce second victim. This is because you are explaining. This is absolutely clear. But your question, I understand, and I explained what happens in Spain 10 years ago. It's about the higher level. It's the top, because at least in Spain, middle managers are participating in workshops like other workers. This is not a barrier for them. but it's not the same for the higher level of directors. Usually they don't go to the same workshops, so we need a different product for them. And the language, the contents maybe are different. And in some manner, there are different aspects. Yesterday, during the dinner, we talked that we have sometimes, well, this is a personal opinion, okay? Maybe I am absolutely wrong. Usually, I wrong. In this moment, in some of our countries, in practically all, we have a very severe shortage of professionals. So if we meet with top managers and say that we have the solutions and that professional need rest, in this condition, it's not possible to introduce anything. So we need to understand them and then need to understand us, admit a common solution, and we need to be realistic in our proposals. Because really, for example, in my country, in my region, there are departments closed in this season because there is not possible to find any professionals. And in some cases, it's very difficult to find dermatologists, surgeons, anesthesiologists, nurses as well, in some cases for specific areas. So it's very complex. I am in a sabbatic year, and in the care in my sector during some months was hard to find a clinical psychologist for occupied month C. So it's the shortage in many professions are a very hard problem. So we need to think how it's possible to ensure care under these conditions. Otherwise, we can create a theoretical, fantastic vision of the world, but it's not. We need to put the foods on the earth. Okay. Yes, Gracia. Thank you.
Just a comment to what you said about the shortage of staff. Joint Commission has recently introduced the standards for the accredited organizations about staff retention. And I very much believe such a discussion about the second victim with high-level board members could be very useful within also this area of keeping the experienced staff, not to let them leave to another organization.
Thank you so much. Thank you so much. And yeah, just a little comment because I think this is very critical information. In some manner, we can transform the problem of the second victim in a solution, because if you are introducing support programs, you are able to retain professionals as well, because professionals understand that you are worried about their well-being. So we can change the situation, and a negative thing, maybe we can convert in a positive thing. But we need, that Milena suggests, to think in this type of target, because they, as like other policymakers, they have in their hands to make decisions. So this is very good. Yes.
I want to add one thing. I'm sorry. I'm not here to say that.
No, it's good, it's good.
So everything is always involving around managers. So we are always forgotten. This is also the reason that most of the people don't really want to be nurses. So the peer support, it's really important because we also feel a little bit involved. We are important when we are forgotten. And of course, the managers they are taking the decisions, but their decisions and the reality, they don't match. So in my opinion, yes, the healthcare workers, they must need to be involved in the peer support, in the decision making, in many other things. And that's, I'm sorry.
No, thank you. Thank you so much for any contributions. In my experience during the pandemic, the high level of, well, we organize some support. well, all professionals are affected by the pandemic, so any support is a little thing, but we try to organize some support for our colleagues. And was a surprise because it's the first time that the top manager asked us about what happened with us. We need support as well. So this is a very good opportunity because moral distress. Our top director have sentiments as well, emotions, and I worry about what happened in the hospital. So they need as well some support. Of course, 5 years, not like one. So we need to think about that. Thank you so much for your.
Just to add something, she's right. We did civic studies in Austria, and there's a field where you can comment on the study. And I think it's written, I don't know how few. Finally, we heard somebody is listening. Thank you for the study. So it needs healthcare workers from the bottom need to be involved, but it's not either the healthcare workers or the managers, it's both. Because you need to have the managers to get the thing done. So that you need to rise some pressure maybe from the bottom approach, but also educate somehow the managers. So I think it's both. Get the thing started. You need those.
Yeah, yes, this clear. We need. And in some cases, the other level, policymakers in the Ministry of Health, national agencies, but really the bottom is important.
But I believe that the biggest problem is not the high management, it's the middle management.
Yes,
The middle management, they are, you know, they are the hand from the south there. They have a lot of pressure from us, from the management, and sometimes they don't really have the skills, not only to be managers, they have also be leaders.
yes.
And that's.
No, absolutely. This is clear. Now, middle managers are critical, and is the key of the success of many of the intervention, not only in the psychopaths. That's absolutely clear. Yes. We need to think there's some time for one.
I would like to ask you, how are you going to sell this idea to the government and to the institution? Because I'm a nurse manager and I realize that the most important thing in our health system is the resources, the money. So I compare this group, the rescue group, like the European Association group. It's like you have to follow a training to be a instructor, and then now you are going to be a trainee, but you have to pay for your own training. So how you are going to encourage the staff to do this training? Yeah.
Well, we need to work on all these questions. We have some ideas when we are preparing the proposal for rescue. But for example, Reina later can explain that we calculated what is the minimum amount that we need to ensure the sustainability of the rescue in the future, because the first year there is no problem. We have the money to put in practice this idea. It depends about what solution we think is the best, and we need to open a debate among us about different alternatives. But in any case, I think that the first step is that we exist. If there are any relevant private company that want to give us a lot of money, it's coming today, in some minutes appear here and say, I have $1 million for you because your idea is the best in the world. We have a problem. Any of us, well, here are the chair, the leaders of the working groups, I'm the chair. Any of us can the possibility to sign, because any of us, we are nobody. We are not able to sign any agreement because we don't exist. The first is that we exist as foundation, society, friendly group or whatever, because we need that some of us are able to sign whatever. For example, the government of Serbia hear about us and coming today and say we want to move because for us it's the most important thing in the world. Any of us can say anything. Well, we can say yes, we are willing to work, but who are able to sign on behalf of all? Nobody. So we need to change our mind, because this is a different environment from the 1st of November. The second is, if it's clear that this is a non-profit intention. But well, this is clear for all, but we need money in any case. So we need to identify if we go through the path only public procedures, public system, or we mix public and private, or we ask for private companies. In some cases, we are in contact with some private companies as well. The sample that Rainer explained before about one of the states in Germany, that this is mixed, public and private. There are some examples around the world. Maybe it's public and private, the rising Baltimore is following this type of system, so it's possible to organize it somehow. Of course, we need that Sandra opened the door, talking with the President of the European Parliament. So this is an opportunity as well that we need to activities in this sense. And of course, we need to think how it's possible to introduce. It's realistic that 39 governments agree with work with us. Absolutely no, this is not realistic. But in this moment, I think that there are at least 4 options in 4 countries, because some of the members of this action, of this network, are in a higher position in different health ministries. So maybe it's possible at least to open some interviews, some debates. But the first is to exist, and the second to decide about our future. So we need to organize an ample debate among us, because we need to recognize there are differences between us in our systems. So Greek is different to Spain. There are many common aspects, of course, but there are also differences. Denmark or Spain are completely different, and of course the legal scheme in our countries is different as well. So we need to integrate all this information and make decisions. Is the only one. Okay, but independent of your question, that is critical as well. I think that there are typical targets. It's not possible to introduce trainers or whatever in our institution if we don't involve middle managers. This is a common experience in all countries. Any strategy that you want to implement in your hospital without middle managers or against a majority of them, maybe nobody say no to the leader of the organization. Maybe during the meeting, all say, well, maybe, well. But some minutes later, when I am talking with my team, usually I say, a new crazy idea of our director. Forget, don't worry. In some way, he or she changes or forget, because there are other problems. This is a typical situation in any country. It's not the Spanish style. Of course, it's our style.
I just have a little comment that about middle managers, because not in every country we have that actually. In my country, there is a direction and boards of the hospital, and then the chiefs of the clinical departments and the departmental nurses and the front staff, and that's it. So actually, the chiefs of the departments would kind of act as middle managers. Also, there are doctors and professionals as well, so they do participate in the training, as it is kind of addressing their part. So also we need to take this into account.
This is because we need to understand our differences. Well, I usually say that hospital in any part of the world is completely the same. What is a hospital? Well, it's the same. But if you have the experience to work in your own country, but in different hospitals, you understand me that are completely different. The culture, the procedures, and many other things are completely different, and the equipment and the persons as well, and the leadership of them. So this is the reason that we need to see and speak. Okay, I think it's more clear. Thank you so much for your contribution, questions, and comments. And now is the time to advance. Sandra, the floor is yours to explain how are some of the advances and gaps that we have identified and we need to face with them as well. Please use the
Can I have the PowerPoint, please?
the PowerPoint is okay. You must use the micro, Sandra, please.
Yes. And has something is tracked.
Sorry. Yeah, this is this one. And yes, you can hear me. Okay, thank you so much.
So again, it's a pleasure to be presenting the work of Workgroup 4. I must say that we had to depend a great deal on the work of the other work groups. So thank you very much to Workgroup 2 in particular for advancing the definition, and of course Workgroup 3 for the massive input, the training material, and that was really of great help to us. I would, oops. So basically, Workgroup 4 members, 29 participants from 19 countries. We had multiple meetings amongst those, apart from the MC meetings, two face-to-face, but we had quite a number of virtual meetings. Remember that 2 years of this cost action was actually during COVID times, but we had also a very interesting international symposium that was organized by Workgroup 4 during COVID. And I would, these are all the members. I would like to remind you of this great meeting. I would like to recognize the work of Lucia Prihodova, who at that time was working with the Irish Royal College of Physicians. And of course, it was actually advancing here the importance of the subject, giving it an international perspective. It was held on the 26th April 2021. And indeed, the keynote speakers, of course, our great Jose Mira, Albert Wu, no introduction there, who also presented RISE, Resilience in Stressful Events, Peer Support Program. And we also had Professor Stephen Pratt and his team from Beth Israel Deaconess Medical Center, Boston, who spoke on implementation of statewide peer support by the program, telling us what they did, how they did it, and any learning points that they had to go through. So I believe that famous COVID time international symposium that was very well attended, I believe is of great use to rescue that we'll be actually embarking on as a network. But Lucia left, and I had the privilege to be joined by my great colleague, Enough, who today she just WhatsApped me and said, I feel disappointed. I'm disappointed that I'm not here with you. Of course, Enough is at the moment ill, but apart from that, we know that she's in a country at the moment that is going through war, unfortunately. We had the pleasure to visit Israel with my colleague, Patricia Vella-Bonanno, who's online. Hello, Patricia. And we did that barely 4 months before hell broke loose. But there you see Enough sitting quite alert and in an assertive manner. And it showed that STSMs are there to work. And in fact, we were in her office working. And because of that, we actually understood how to get to the deliverables, but more than the deliverables, we even went beyond what has been expected from us. So that was in Israel. So the main goal of Workgroup 4 was to plan to identify facilitators and barriers to change regulations and curricula on second victims through primary and secondary data emerging from different countries and at the EU level. And we emphasized the 3 levels: macro, meso, and micro. I am one who in my research, and because even in patient safety, I keep saying this in my hospital, we need to not only put out the fire when an adverse event happens in firefighting, but we need to take this to a systems level approach. And we can only do this by looking at the 3 levels. And the deliverables, we have several papers that have, some are already published, some are work in progress, but these were mapping patient safety legislation across Europe, patient safety and second victim phenomenon, nursing and medical curricula, embracing a quarter of a century of second victims transitioning to integrated safety and safety generating culture in healthcare systems, the white paper, and also at the end, there is another deliverable which I will be talking about. So with regard to the objective to understand, first of all, mapping patient safety legislation across Europe, and the objective was to understand how legal frameworks across Europe address patient safety and the second victim phenomenon. This is, when we talk about legislation, it's a massive challenge. And the methods using mixed methods study involving a survey, 29 members from 26 countries participated, and web search. I have to give a massive credit to my great friend Sophia here. I think you've helped immensely in this. But why do we need a legislation about second victim? And I believe it's the chicken and the egg situation, isn't it? That means without a legislation, there is no obligation to acknowledge it. But without the field to act, the legislation will be left aside. So it appears that indeed we need to have the content of the law, which is important, that is also identifying the various aspects that can relate to adverse events, near misses, second victim phenomenon. If, of course, I have to be extremely careful in front of my learned colleague. If I understand correctly, in Germany, the patient safety law acknowledges when harm happens, correct, but does not acknowledge a situation where it's a near miss. So sort of, you know, there has to be something that actually has happened, has harmed. And indeed, we need to go beyond that. So another aspect is that legislation needs to adapt to the changes that happen in the field over time. Amendments to the law need to be pushed for by people who are who understand the field, bottom-up approach, because often they are the frontliners who have to feed back what is happening. But of course, our leaders and managers need to be hands-on, need to do a lot of walking around to see exactly what's happening. And this has to be reflected in the legislation. Of course, at the moment, the manuscript is currently a work in progress, but from the information I have, those who are actively involved in it, this will be finalized by the end of the month. Okay, what are the key findings? That 14 countries out of 19 have legislation about patient safety. And then 3 countries out of 20 have legislation about the second victim. With regard to the web search, there has been 39 references about safety legislation, and indeed 12 about safety form and procedure, 23 about occupational health legislation, 6 about formal occupational health procedure, but no legislation was found for the second victim per se. So there again, there's work to be done. And the study reveals significant disparities across European countries in terms of legislative recognition and support for healthcare professionals affected by adverse events. While patient safety legislation is well established in many countries, the second victim phenomenon remains largely underrepresented in legal frameworks, leading to a critical gap in addressing the emotional and the psychological well-being of healthcare providers. Indeed, there are some countries, and I know because as past president, immediate past president of the European Health Management Association, I got to know that it is by law in any organization that the organization has to conduct a psychosocial risk assessment at work. And I got to know about this when I was president in line with Belgian law. So I don't know whether hospitals are actually obliged, at least in Belgium by law, to do a psychosocial risk assessment, because EMA was obliged to do it as an organization. So, you know, these are steps that could help. Then going on to the curriculum. Of course, when it comes to curriculum, we've had a lot of discussions, but the study aimed to explore the facilitators and barriers in implementing patient safety and second victim training courses within both undergraduate and postgraduate healthcare curricula across Europe. Actually, what we did here, we started off with the semi-structured questionnaire, having closed questions and open-ended questions to the participants of the ERNST consortium, but we understood that we needed to go deeper, and indeed we carried out in-depth interviews with 19 healthcare education leaders from 10 European countries, and sort of the data that were analyzed from the semi-structured interviews were also triangulated, so to speak, with also the data from the in-depth interviews. And actually, this is the key results. 5 main themes emerged: recognition and understanding that there is a significant gap between the need for education on the second victim phenomena and its actual incorporation into curricula. The second, curriculum development and implementation. There are many barriers, one of which that keeps coming up across countries. It's interesting, actually, because sometimes we say, well, it's only in my country. No. People complain about overloaded curricula. And, you know, we come from quite conservative schools, like medical schools, nursing schools, perhaps medical school is the most conservative in changing the curriculum. And complaining about you know, how many more subjects are we going to introduce in this curriculum? And the same happens with nursing, midwifery, and professions allied to medicine. Also, regulatory constraints. Universities can be pretty bureaucratic. Of course, bureaucracy is important and good in order to ensure quality assurance of our programs. But sometimes it is many times it is a barrier when universities are not fast enough to acknowledge the changes that are happening in the field. And indeed, interdisciplinary collaboration in this respect, that means if we have schools joining forces like medical schools with nursing schools, with the other schools for the healthcare professionals, then perhaps more pressure can be put on making the transition, the process faster, and in order to make sure that we are in line with what is happening in the field. Content and delivery, there is a need for practical research-based curriculum that emphasize coping skills and the culture for safety, amongst which, very important, psychological safety. To speak up, irrespective from which profession you come. You know, I happen to be the chair of the patient safety and quality improvement team in my hospital. And last week, as recent as last week, I was presenting to the hospital leaders, to the chairs of the clinical departments, about several safety alert reports coming to me about bullying in operating theaters. And in particular, in some fields, like in orthopedics, which is very male-dominated. So there is bullying, not just from the surgeons to the nurses, but sometimes even from the male orthopedic surgeons to the female orthopedic surgeons. I have full respect to the male gender. I work very well with men, so I'm not trying to say something here. But unfortunately, these things are happening as we speak. And it is not easy for people working in these environments. Student engagement. Yes, if we are as passionate and as engaging as our leaders of this cross-section, Reinhardt and Jose, who made us passionate about the subject. So why not try and be passionate ourselves as mentors, as coaches, as whatever, as lecturers, as heads of departments, to make our students passionate about patient safety and about also recognizing that we are human beings, and therefore student engagement in this topic. Lifelong learning, we all know that even though you know, years pass, you get experience, nevertheless, we don't know everything and things change. So even in these subjects, I can confirm that in my hospital, if you talk about subjects like patient safety and second victim phenomena to those who are, well, my age, about, you know, a few years from retirement, we may not acknowledge that these problems do exist. And therefore, yes, we need to be the leaders to push for CPD and lifelong learning. So the addressing the second victim phenomenon and patient safety in healthcare is essential, but challenging efforts must focus on overcoming curricular, sorry, I can't read everything because there's my if I can push this. I forget what, yeah, okay, I think, let me put it a bit here, if you don't mind. Curricular constraints fostering interdisciplinary collaboration and engaging students and educators to enhance patient safety and support for healthcare professionals. The third, embracing a quarter of a century of second victims, transitioning to integrated safety and safety-generated culture in healthcare systems. And here, evolving the understanding, the concept of second victims. Healthcare professionals traumatized by adverse events has evolved with growing recognition of its impact on entire healthcare systems. Nevertheless, this has been quite amply discussed in our group, and we know that there is no better term. Yet, we did spend time in discussing what if, you know, a better term comes, and maybe we should not be happy that, yes, this is established, this is, if there is criticism from various areas, sectors, we need to keep on thinking. Maybe we need to keep on thinking in order to embrace a more integrated approach to safety and accountability that is being recommended here. Okay, so the integrated safety culture to improve the safety, the healthcare systems, needing a unified culture that supports both patient care and healthcare professionals, including better education, robust support structures, and proactive policies. And the action required, therefore, is a call for systemic changes to foster a safety-generating culture that values transparency, fairness, comprehensive support for all involved. Then all this with regard to the curriculum, because I know Jose was very, you know, happy to have this as a deliverable. And indeed, we had the white paper that actually the aim is to ensure patient safety and the second victim phenomena are integrated into the core curricula. And again, the key recommendations, development of standalone courses, innovative educational approaches, faculty development, which I've already spoken about, the interdisciplinary collaboration, as I said, addressing the curriculum overload, student and stakeholder engagement, and continuous professional development, and also collaborative efforts for implementation, engaging regulatory bodies, professional organizations, and policymakers to ensure the successful implementation of these curriculum reforms across European healthcare education systems. This is another deliverable that I've worked very hard on together with my colleague, Patricia Vella Bonanno, and indeed we have full-fledged running Master of Science in Patient Safety and Clinical Risk Management. It started off with 30 ECTS and then continuing as a by research, but we got the second 30 ECTS as a taught component, and 10 ECTS of which are on implementation of integrated safety across the levels of healthcare ecosystem, which is actually the output of this fantastic cost action ERNST, including second victim. So the first time it will be running is, because this is the course that is opening in October, I'm happy to say that I made, you know, in Malta I have to do everything. So if you have a course, you need to do the marketing for the course. And I met with stakeholders in the private sector. I went, in fact, I have a memorandum of understanding to sign on Monday with the body that runs in a public-private partnership model, the nursing homes in Malta. And in fact, this very organization is sponsoring 4 places, and they've already sent 7 of their staff to our courses. Okay. I've also made meetings with the head of the postgraduate medical training school in Malta, and made inroads. And in fact, on the program, I will be having resident specialists, which is the grade below the top consultant grade. And they are, it's a win-win situation. For me, I am sort of happy to be creating more champions. For them, they are getting a qualification, a master degree that will serve them well when they apply for consultant's post. But they will become champions. And when they become leaders, they will be focusing on patient safety, which may not have come so easily during the conservative training program that they've gone through. Okay? So this is my idea. Plant seeds everywhere. Sometime it will sprout, sometime it dies, but then you plant another seed. This is the way I'm working. And again, also research. By research, we're having PhDs, we're having masters by research, making sort of the subject something of a great interest to go into. And this is planting also seeds here. And I think it's working. Not without challenges. For example, I have to say that in my hospital, with the current change in minister and leadership at the moment, the minister is quite happy with the second victim training that, for example, I had, as you know, in the training school in Vienna. I got no more than, in fact, I have a picture. This is the training school in Zagreb. But this is the team that came from Malta on the second victim, and the minister knows about it. But the current leadership I have in hospital have not really embraced the second victim support program, but I don't give up. I don't give up. I keep on going. And that's why wearing many hats is important, because if I'm blocked here, I come up from the university side. If I'm blocked at the hospital, I come up from somewhere else, publications, research, networking, you guys, you know, so I keep on going. Eventually, it will stick somewhere. So this is us. Thank you very much. Again, I acknowledge the work, massive work of several. I wouldn't say all the members in Work Group 4 were active, but many were active. And I'm not going to try to pick up names, because I will for sure forget some key ones. But it has been a wonderful experience for me. I have to acknowledge the massive help I got from Jose when I got stuck. There were situations in these past 2 years where, as president of M, I had challenges, but I was fully supported by the leadership of this cross-section, by Sophia, who's been absolutely, as Paolo said, she's an asset. Of course she is. Well, she's your Cristiano Ronaldo. Well, not as rich. Not yet. So thank you very much. And Ina, thank you, Ina. You're hearing me.
Yeah. Thank you. Any questions, comment? Nazareth, any comment on the chat? Any questions, suggestions, comments?
Of course, maybe you may be thinking Roberta Metsola. Roberta Metsola is Maltese. She comes from the tiny country of Malta. And before she got elected as an MEP, she contested the elections 3 times without getting elected. And she is an inspiration. She never gave up. But once she made it, she not only proved herself to the Maltese electorate, but she's become one of the top in Europe. And she's happy. In fact, Jose, please give me any package, any summary. I promise you, she promised me she would like to meet a delegation of both ERNST and Better Care 2 in 1. And I will make that happen. So she's really keen on healthcare. She has also described situations where family members of hers were involved in adverse events, and therefore she feels this, not only from a politician usually. I've met many politicians in my life, but when I see a good one, I say, we can do everything.
Thank you so much, Sandra. And a special thanks as well to Ina,
Yeah.
who is behind the work of this working group as well as leader of this working group. So, well, let me some remarks, okay? The first that you will address because you are participating a lot during this session, so we can enjoy around the city. The lunch is at 12:30, okay? So we have some time for rest. People living this day in this hotel, 12 is the last time to leave from the room, so we can use this time as well to pay the room or to organize before we back to the airport or whatever. Remember, 12:30 is the last in the same place that yesterday is just to upstairs. Second remark is we meet here 2:45. Professor Adelbu is participating in this afternoon. So we are some innovation about the study of second buildings, as well what they are doing in the right program in Baltimore, because it's till now the most expanded network. More than 100 hospitals are participating in the RISE network. So it's an amazing result, and it's a very good opportunity to know more about this program, about this approach, and about the second building phenomenon around the world. So lunch is 12:30, and we meet again 2:45. Well, a quarter to three is the so early to organize to sit down and because we organize it within the conference, the online conference. And the last remark maybe is also very important for you. As you know, we have only some days to organize your reimbursement. So, first, you need to sign. If any of you forget to sign yesterday, this is your last opportunity. Reynard, give you only 5 minutes.
You shall not pass me unless you have signed.
So please sign.
Our guide.
Sign for yesterday and sign for today. If you are members of the management committee, you must sign twice for yesterday, not only one. Okay? And please use the same signature.
It's like our guide yesterday.
And the last, please,
Yes, sir.
remember that if you have any questions or any doubt, please ask Natalie or the experts today. I know that is complex and sometimes difficult to understand instructions because you are here, but you receive only one reimbursement. What happened with yesterday? What happened with today? What happened? Nothing happens. I need to sign. So, this is because it's not possible to receive two payments from the same travel. So, Natalie and Mercedes agreed with COS in Brussels to organize only one payment. Since we can receive the day after and the day before, one payment for this forum cover all the options because you arrive on Sunday and leave today or tomorrow. So there is not any problem. But if you are participating as well in the meeting that tomorrow organized Paulo for the better action, this is a different situation. Just in case of any doubts, please use this time to ask them and to resolve. Because we agreed as well with Brussels the best solutions, because it's not possible to receive twice for the same claim. Okay? So this is the time to resolve all things, but please remember that if you don't close on the course platform asking for your reimbursement and update all the tickets and the information about your departure, arrival time, and so on, it's not possible to pay this problem. Because the last day is this week, because we need some days to prepare all documents and to be ready to show to Brussels. Please understand that this time there is not so much time. So thank you so much. This applies as well, people from Serbia, because you receive as well the gay allowance and other things, of course not the plane, but the rest is absolutely the same. So thank you for following these instructions, and any doubt, please, this is the time to resolve, because after this meeting is more complex. 12:30 for lunch, 2:45, Professor Albert Wu is speaking, so arrive before, please. Thank you.
But you need to be I would go asking on that. I then saw the results, but I couldn't read all this is not okay. I'm sorry. Because we spoke and we told each other as a just now and I is it possible to make a photo right after lunch? Everybody yeah, okay. Because I think also that Philip Michel gives and finance one, so we will be missing. Okay. Leaving already. Yeah,
Going to make a second check back on
And I joined my dear and Paulo.
Okay, so at the end of the day, 2, 3, 4,
Spend so much money on bridges.
I guess.
So many meetings, I was the best thing in the country. Running around. It's been really great. I heard that from you. Yes. Okay, maybe.
Gut, wunderbar. Ja, schöne Grüße von Paulo. Und auch um 2, also ich bin zwischen 2 und 6 wahrscheinlich nicht so gut erreichbar, weil ich über München bin. So, jetzt schauen wir mal. Ich kann es auch gerne gleich jetzt wechseln. Du weißt Bescheid. Das wäre einfach. Center, and I will right now. Yeah, exactly. Telling her that I'm on. I know, but I think that maybe also something why I know that it's Guyana, but I don't know what's the other. I will yes. yeah, also take a. Yeah. Yeah, now from some daylights. My problem is so sometimes I take a picture of her saving glasses. No, it's not good enough. Yes. No, it's not good enough. Slide over the edges.
That's more than Marina, you'll have another picture of it.
Oh, yeah. Okay.
Yeah, artist.
Thank you, sir.
Thank you.
Thank you.
Thank you. Can we share this?
Oh,
Yeah.
Can we share this as well?
Can we share this on our LinkedIn account?
Yeah.
Is it okay for you?
Yes, excellent. Yeah, just send me WhatsApp and I will include it in the. It will include it. Yeah, but just a second, I now know how to do it easily. Just to give you the QR code and you can scan it. No, with the WhatsApp. With WhatsApp. So you just have to go back to your account, then 3 points, then this, and then you can, or then you can.
There it is. Yes.
So, see you. I even know the menu in Turkish. It's just. Okay. Excellent.
And now I
so much to learn from my daughter. I have to type in the telephone number. Oh, yeah. Adding your content. Yeah. So. Excellent. So and I can send you back how you should have. Yeah. So at the airport, I all the time go to post and always like I always post some pictures from the venue, of course, but also some from the cities, which are also very nice. And I always have to share at least one photo of food. Oh, just to keep my colleagues' chins. Yeah. Just also to show that, of course, we work a lot, but it's also fun to. Yeah. So I will be today or tomorrow. Okay, so you have time tomorrow. Okay. So I have a direct points from here to this. So unfortunately, I have to go at 2:45. So when all the rules start to support, I have to go to the airport because tomorrow is the day. No. I'm follow hospital, but I said I have another appointment. So September is always because September there's no lectures. So like September is busy like hell. And also in preparation of our patient safety day, which will be also a crazy day because I will be in 3 cities at a time and 2 countries. So tomorrow I'll be in Wiesbaden having a lecture with medical students also from Hamburg. And then I have to go to television to make a television broadcast. And then I have to go to Frankfurt Airport to Lisbon because next day is better care training school. And 2 days in Lisbon, then it's going back to Berlin because then I go to the Board of Physicians in Berlin. So before that, on Monday, I even have another appointment in different cities. Yeah, so in October, there's the training school in Alicante together with Jose and Paulo and Susanna and the students from Finland, Spain, Portugal, and Germany. And so the hotel is right at the beach. And families will leave. And if I tell them this, the beach is in that direction, I cannot. They cannot tell a second sentence because they are already like in the water. Yeah, and that will be good because it's partly virtual, partly in person, and in the afternoons the other colleagues will make the lectures. So I will sit at the beach, make sure that this gets brown as well. Yeah, but September is well, always. Yeah, because otherwise everybody's trying to put the conferences, like Oscar conference also in this time, because everybody knows that there are no lectures, so the scientists can more or less freely travel. So that's why everybody's pushing it. And on the 13th of September, there's World Sepsis Day, and the 17th is World Patient Safety Day. Whoever had the idea to put those 2 days like together. Yeah. Yeah, 13th of September. So normally everything's silent, and like 2 weeks before everybody's calling. So is it like yesterday? There was a lady, nice lady from Switzerland calling. In the week of the World Patient Safety Day, is it possible that you give a lunch seminar from 12:15 until 1:00 p.m. at any of the states? It's like, okay, Monday I'm there, Tuesday I'm there, Wednesday I'm in Lisbon, Friday I'm in Berlin. Wednesday.
Virtual.
Yeah, even online, it's not possible because there's only one day where it would be possible. This is my thing. So it would not be possible to have lunch, and I work from 7 to morning, 8 o'clock in the evening. There's no way. Yeah, and I asked whether my research assistant would do so. She's happy to do, but Victoria or Hannah. Yeah, no. The interesting thing is, I have to brief them from Sophia because both of them are now in Portugal, having STSM, better care STSM, and then they go to a conference in Cascais, which is near, and then they have a better training school. So they are now on work in Portugal for 3 weeks, 3 consecutive weeks. Next time I see them is the 18th of September in Lisbon.
When I had a meeting with her, she was in Mozambique.
Malawi.
Yeah,
Malawi. Was in Malawi. Yeah, they have a project going on there. So she came back from Malawi. Then she had like 1 week of holiday, and now she's 3 weeks in Portugal. But they are still young. They like it. It's good for them. Yeah, it's good for them.
Very good opportunity.
Yes. Yeah, and Victoria as well, because she's preparing better care also. Quite intense, but of course, after the first time, she also had a routine. And next time, maybe anywhere else, it's not a problem anymore. Yeah. So, and for them, of course, it's a very good opportunity. Yeah, because Victoria is one of the MC members, and I think it was even for Germany having so much post actions. It's a rare situation that somebody with a bachelor's degree, master's student, is an official management committee member of an agency.
That's like advantage in her curriculum.
Of course, and also by means of like looking at our institution by means of promotion of women, of course, and also by promotion of young people. It's a fantastic message.
You provide those opportunities.
Yeah. So my intention is that if they are as good as I am now, they are better than us. Yeah, that's my
What
intention.
a beautiful goal. I mean, not everybody, not every master thinks like that, huh?
Yeah, so I think a lot of people thinking as long as they are smaller than me, everything's fine. No. Because I worked basically on my own. I didn't have any mentor.
Yeah.
So I was like a wooden wall, just go to my way. It was okay for me, but of course, the way was much slower than it's for them now. And so I said, I promote you as long as you don't sit stop. Yeah, and of course, in Germany we say you will grow with your challenges. You will grow with your tasks. And some of the tasks are of course really big. It's out of the comfort zone, but it's still within the zone of safety. So that's still a safety net. But of course I said, well, if you agree to do so, so Hannah, for example, she's managing the Malawi project as a major researcher. So I'm just an assistant in the project.
You're just counting on her, huh?
And I said, okay, this is a unique opportunity. Of course, you can also make mistakes, which is normal, but it's of course not as comfortable as being a junior researcher just doing what I say. But sometime or someday, this stage of your career will end, and then either you will be not a researcher anymore because you cannot be a senior junior researcher, or you will become a professor yourself. And both of them have potential. They follow, and of course, there's always surely. But if they have the potential to keep their potential, they both have the potential to become professors themselves. And maybe they will become professors even when they are younger than I was. So I became professor when I was 36, and maybe they are professors when they are 30.
But 36 is even a young age to be professor, right? Even in Germany.
Yeah, even in Germany, yeah. Yeah, but well, let's see whether they make it with
Yeah.
Yeah.
They have already like how many papers now?
Hannah and Victoria both, I think they have an age index of 7 or 8. And Hannah had made it to her master. She now will finish her PhD on the PhD program of the state. And he published the second paper of the she can finish the PhD in, let's say, March or April next year. And maybe another PhD progress as well.
And what is she planning to do? I mean, or do you have a plan to keep her in your
institution or postdoctoral researcher? So we apply for grants that she can be a postdoctoral researcher. Also instructing other junior researchers, of course, because you have grow with us, doing some other lectures, and then she works like 3 years in university, and having lectures and having published. There's not a professorship in our university, to be honest, but of course, there are other professorships on other different universities of applied science, not so either she can make an application, become a university professor, or she can also go to University of Applied Science anywhere else. And I would just encourage her to apply, maybe the first or the second application is not successful, but of course you learn. And if this can be her plan in the future, because I cannot it is what the plan in the future. She would be very attentive. So, and I think Victoria, Victoria has the same age as us, and is now a scientific coordinator, but she's still finishing her master. And even finished master. And then, of course, after the master, she would also enroll in the PhD.
Yes,
so that's
longer way.
Yeah, but she managed to do so at an earlier stage of the career.
Yes.
And I thought about when the time was that I got an age of 8. Was at the time I was.
Oh, yes.
So and yeah, so they take the opportunity. They work hard, but also they know to work for it. So coming back and playing off of that. And of course, I'm very fortunate to have these both young researchers because they are taking really so much demonstrated work from me that I can.
Yes, sir.
Yeah. Yeah, so, or maybe sometimes even the right brains, left brains, and the hands as well. So, and the thing is, if you train them well, I can now say that, okay, they have technical problems in the second study, you will solve it, and just do it. Don't ask me anything, we don't have the right solution, just do it. And if I can support you in any way, then you can ask, but otherwise you will just, and so also to give them the possibility to decide. Not like big major decisions, of course, but the more responsible they become, the more bigger the decisions will be. Just because in the end, it will be horrible if somebody always comes and, can I make it this thing? Can I paint it blue? Can I make it like
Too much like.
Yeah, and there are some colleagues of mine, they are kind of micromanagement. Yes, what's your impression? Okay, I fully trust you, and if you have the feeling that this is really beyond your capacity, then you will. Yeah. And
But there are some managers who want to be consulted.
The majority of managers is not that.
And most of the time, they tell you, they tell their workers, so like, okay, you can make your own decision, you can decide about that. Then they make a decision, but after that, he's like, why did you make a decision? Especially when the decision doesn't turn out to be very,
Yeah, everybody has the right to make mistakes, so as long as they have the courage to decide on something, and I know them very well, and I know they are trustworthy, and that's the only thing. So if they make mistakes, they make honest mistakes. Yeah, and this leaves so much more capacity and so much more freedom of mind as well. Because those who make management, they are always unlucky because, of course, you cannot look into my head, so you never do a decision exactly like I will do it. That's normal, but as long as I have a peace of mind, everything's working. So we have like, guess how many working group meetings we have? There are some working groups who have weekly meetings or 2 or 3 meetings. So normally we have
do they get paid by your institution, Wiesbaden, for the time they spend in those like soft action meetings or meetings? Like
so they're full contracts. They're full contracts.
Okay, but they don't get extra pay.
So they get the per diem from yeah. So now
no, not from the cost. You're from the institution you work for. Aren't they like in the payroll of Wiesbaden?
They're fully paid.
They're fully paid?
Fully paid. Whole research system. Like I don't know how much it is. And probably 4,000, 5,000 euros a month.
And
important.
The management of Wiesbaden at your institution do not tell them, hey, you cannot take part in that action, right?
Yeah, my institution.
All right, so you decide, you're the one who decides.
So I earn the money for them.
All right.
So and as long as I don't break any rules. And as long as we agree, like Victoria, Hannah, and I agree, they do whatever they. So of course that would like but as I said, now it's not lecture time. So as long as the few hours, then the 4 hours during semester. Otherwise they don't even have to be in the office. So they work remote most of the time, as long as the work's getting done on Friday. Yeah, and so now there are 3 weeks not off, but 3 weeks away. But of course, I can call them every time or something to be fixed.
And I can, you can see the progress they made.
If they are now on the beach, sunbathing, as long as the work is done, I don't care. And so of course, my decision, I have to assume that they go on them, or we have to assume that normally one of them or myself is always present, that something happens. So also by holiday, I mean, the holiday is like if I'm on holiday, one of them has to be there just to cover up emergency situations. But most of the time, they can arrange their time, whatever level. They have some goals, they have some complications, they have some project that's going on, and they have to meet deadlines. And of course, if they don't meet deadlines, then it's uncomfortable. But as long as they meet the deadlines and do excellent work, who am I to tell them what they have to do there, or where they have to live, or if they have to
They are so privileged to have a mentor like you.
probably tell them, please tell them.
Especially if,
Sometimes I joke,
if we get the grant for, you know, Donor Plus project, Hannah will be automatically an MC member and we will have a chance to, you know, convey our messages, how we think about it. They should, okay, I understand, sometimes the boss can be pushy and, you know, like demand so much, but I clearly understand, you do this for them, not for yourself. And
Yeah,
they
but
can understand this as well.
But also, because it's in the mitigation, so if you put pressure on the group, you can achieve more in the short term, of course, like for weeks so long. And sometimes they even have to say, so now, girls, this is the deadline, and no matter what it takes, we will meet the deadline. And of course, they don't discuss it or say apologies, but it's okay, whatever it takes, we will cover the deadline. Because this is a common goal, and we cannot discuss with the calendar or with the date. We cannot discuss with it's pretty much, but most of the time, it's the other way around. It's pretty much a plan. And it's not like being a physiologist. There's nobody's dying. Yeah, nobody's dying. Like if I miss the intubation, somebody's dying. Nobody's dying. Yeah. So it helped me a lot to work in such a life-threatening environment, because now I can say, if it's an emergency, somebody's getting the flu. Yeah, or somebody's heart will stop. That's an emergency. The other one just
Can be taken care of.
some people down. And yeah, and that also helped me that Victoria, for example, she was an anesthesiologist, so she also got the theater. It always helps because you have another dimension of getting things right. Priorities, what is timely, what is unimportant, and also even or somebody freaks out for nothing. But like just freaking out. But yeah, so I'm very fortunate to have these all because they study health economics and and yeah, and so in the long term, it's of course better to be, because if I have somebody who can fully substitute me, I have a privilege. If I can holiday situation, I say my mobile phone turned off, and if there's an explosion at the campus, I will read it in the newspaper. And that's it. So there is no thing, if it's important, if it's urgent, then you will decide. If it's not urgent, not important, just leave it there. And if it's important but not urgent, just postpone it. And there's nothing wrong. Yeah. And if it's urgent and important, you will decide. Of course, you will take responsibility, but I fully support you. As long as you don't make any shitty action, or as long as you don't betray yourself. Yeah, so it's also a strict no assault policy. And once the short-term researcher was like intriguing and playing against each other, the contract was terminated because we have a strict no assault policy. So we don't have to be the best friends in the world, because there's work, there's private life, but we have to respect each other. Anybody is like posing or making constructive comments or whatever, he or she will be immediately out, because all in all, it's about trust and it's about good relationships and psychological safety. And if this is not guaranteed, it's my job. Look, if this is not guaranteed, nobody has to stand. That's fine. Okay, well, so, but all in all, I think there are only few people doing this, but all in all, it's so simple because it doesn't cost any money. And if you think about the long term, it always stays okay. Because if you do it, it always also comes back. I would also do this without doing reimbursement, because the nature of my philosophy, my mindset, but of course, it also will be for me, because I have two highly resilient, self-responsible researchers, and I try to keep them as long as they are not applying for any question. But if they do, I'm glad to support them as well, because again, this will be a lifelong network and collaboration.
Right, I sent you the email. Can you check if it just reached you?
For Andrea?
For Andrea. The email that I sent, just to tell who I am, because she might not remember.
Yeah. Yeah, got it. Got it? And I will just.
Yeah, thanks a lot. Regarding the Erasmus Plus project we wrote, we are expecting the national agency to announce the results in October by latest. It's not announced yet. So once
Yeah,
they
we
announce
can but I'm really just see what they just fingers crossed.
yes, exactly. Fingers crossed. What? Go ahead, go ahead. We'll talk next. Tamam. Alya.
As always.
Thank you. Telefonu sende mi?
Yes, yes, okay, so, and I want to see
Okay.
Try to solve it's fine.
Okay, no worries.
Thank you for everything.
Claro, pero no te abre, si no vas a reclamar, no te abre para poder buscar. No, claro,
Dobar dan, Sonja Marina je. Evo dobro, ja imam juče danas neku konferenciju, imam puno stranaca, ja, ako mi veruješ, tek sad gledam pozive, imam gomilu korespondencije, vidim, primećujem tvoj poziv od juče. Nisam, ovog puta ja dočekujem i evo sad sam na nekoj pauzici, sedam da pregledam telefon i vidim da si mi se javljala. Pa dobro, malo smo bili nešto preklasani, ali izgubili smo se. Strahinja i ja, deca su onako manje više ok, ali ja sam bila za vikend, jedva sam se pridigla u nedelju, a u subotu sam onako preležala u nedelju, sam već morala da budem aktivna, zato što sam se pripremila za juče, ali evo, još malo pričam kroz vas, ali nisam loša. Da. Evo da ti kažem nešto, pošto se nama javljao majstor Stolar, nismo se još vidjeli sa njim, treba da se vidimo sa njim da ono uzmane mere, još on je prosto imao neku vanrednu situaciju letos i on tek treba da dođe da uzme mere, da bi krenuo da radi. Mislim da je i njemu najzgodnije da on ima nekog svog, da on sa nekim svojim paralelno radi, jer njemu zapravo trebaju te informacije kako da prilagođava kakve rupe i gde šta u nameštaju. Tako da bih ja to njemu prepustila, da se ništa ne pretjeramo oko toga, on će prosto to organizovati čoveku sa kojim radi kad ima takvu potrebu za prilagođavanje i to. Tako da hvala tebi, imali smo se nije o tome i meni deluje nekako jednostavnije da prepustimo to njemu. Da, jeste, opet se nekako baš stalo, bukvalno evo dva meseca praktično stojimo, jesu bili većine, bili su godišnje nastavnici, malo ljudi pribiraju sebi, tako da ja bih to ostavila njemu, kad dođe da meri, samo ostaje da potvrdimo i da mislim kroz to vidimo još jednom jel to može, ali ja ne bi se ošte petljala to, nego bi ostavila on ima projekat, sada treba da ide struja, pa ćemo se u kodu, jel to ide, ne, jeste, da. Tako da, eto, hvala ti. U slučaju da nam treba pomoć, ja zovem, ali neka on to rešava sa tim, sa kim mu je najzgodnije da radi. Ja bih tako prepustila. Na zid, ali misliš da si... Ne, znaš šta, nisam uopšte stigla dotle. Sad mi malo uhvatio i ovaj posao i organizacija celog ovog skupa i svega. Tako da, ostaje mi malo, meni inače septembar lud, razni ove dece su rodili u septembru ili neke svade, tako da mi je potpuno uzeti od samog ovog početka. Tako da, tek tamo, kad prođe septembar, mogu da mislim o tome, pa ću tamo usput malo da razmatram šta može da dođe u obzir, pa onda se javljam tamo od oktobra. Eto.
Everybody. In 2 minutes, we are connecting also our YouTube channel to spread this lecture and the ceremony. So please wait for 2 minutes more and we will start soon.
So this is a congress that will be held in Dublin under the topic of health systems, ergonomics, and patient safety. So it's linked to ergonomy, healthcare workers, etc. So it's a very interesting congress. If you are available and interesting, please can get this information. Yeah, next year. Okay, please go ahead. Yeah, in Dublin. Yes, next year.
We are ready to go. Okay.
Yes. The abstract submission is still open, so you can submit your studies. And it's very good for networking, So there are a lot of people working in this area or related with. So it's an interesting conference.
Okay, so if you're right, you agree we can start. Well, first of all, thank you for coming again. Thank you for your participation in this forum. Also to our colleagues online directly in this session, and also to all people following us through our YouTube channel. So thank you so much to all. And I'm very pleasant and honored to introduce Professor Wu. Really, Professor Abelu doesn't need any introduction. I think that all of you knows his work. But this morning we are talking about RISE program. It's probably the most expanded program. More than 100 hospitals belong to this network, and it's one of the references that we are studying in our actions. But also I would like to send to Professor Albert Wu my special thanks, because he's very kind with us, with this action. He's member as well of this action, as you know. I'm very happy to say you that today, in this morning in Europe, we received that our publication, our manuscript about the ERNST policy statement has been approved for be published. So we are very happy for today, and very happy to share with you this good news. And well, I say that special thanks because always that I am writing you or other members of our core group, you are so kind and say always yes for lectures, for workshops. I remember that one of the first workshops that we organized, Sandra organized in the past to introduce this topic in Europe. You were so kind to be one of our speakers. So thank you so much for all. And we are expecting to close. We stay here in Belgrade for 2 days, debating about the results of our action and new ideas for the future. So we appreciate any suggestion, comment, and your lecture. Professor Lu, I am very present, and the floor is yours. Thank you so much.
Thank you so much. I am honored to be invited to join with this group today, and I am very sad that I can't be physically there with you. I've actually never been to Belgrade, which I understand is very beautiful. As I saw notes that you were out to lunch, and that made me a little bit sad because I wished I could be with all of you. I want to congratulate you and the group for accomplishing a great deal in the last few years that ERNST has existed. When I first wrote about the topic of the second victim in 2000, this was not a major discovery. This was a problem that every health worker is familiar with. We call this a problem that is hiding in plain sight. But it wasn't something that people considered was a public health problem. It was a problem that they thought was their own personal issue, perhaps their own personal sign of weakness. Perhaps it was something that they should be ashamed of. This is really a human issue. And this was something that I became more aware of when I began to study patient safety back when I was really still training in 1988. And even before this, when I had my own experiences, my own adverse experiences in taking care of patients. And I think that this is something that ERNST has helped to make clear, not just in an academic way, but in a global way. I think that ERNST has helped to raise the global awareness of the problem. I think it is one of the first big coalitions to think about the problem, and I think it is certainly the best. I think that the publications that have resulted are something that you should be proud of. I think that the paper on definitions helped expand people's thinking about the problem. I realize that perhaps a mark of success, besides the number of Google citations for a term or for our publications, perhaps another sign of success is when you begin to develop what we call in English haters on social media, or we also refer to these as trolls on social media, who make disparaging comments, which I think do not display understanding of the problem. And we certainly have people who are unhappy with the spotlight, which we and you have put onto the problem of the second victim. The problem really is not, this is a problem which I believe that patients should be aware of, certainly providers should be aware of, but it is not something that takes away or detracts in any way from the problem of patient safety. It is simply that what we do involves humans, healthcare workers, humans taking care of other humans. And if we want things to go as well as possible, it's crucial that all of the humans involved in this process are doing as well as possible. There's a new emphasis recently on worker well-being. This was emphasized by a couple of years ago by worker safety is patient safety, a theme put forward by the World Health Organization during the COVID-19 pandemic. And I think this is crucial. I think that I'm not sure that it is the job of this group to take this forward, but I think that not only do we want to acknowledge and help to prevent and help to heal workers who become second victims in their work, but we would like to optimize the well-being of all workers so that they can do the best job taking care of patients. We really would like to foster a culture of well-being, not just among workers, but more importantly, among healthcare organizations, healthcare institutions. Those institutions need to be able to think in a practical and concrete way about what they need to do to take care of their workers so that those workers can do the best job taking care of patients. So I think the work of this group is just beginning. I think the policy statement that Jose mentioned is another important step. This is something which is only now beginning to be thought of in policy circles, but it is not until top leaders, including funders of healthcare and those who organize healthcare, have this in the front of their minds also. It is only then that the problem will begin to be addressed seriously. So once again, I'm honored to be here with you, and I'd like to congratulate all of you. You should take a moment to pat yourselves on the back for a number of years of good and hard work, some very successful collaborations, your success in bringing together some workers who are not strictly researchers and bringing them into the research enterprise. I think also bringing some researchers closer to the front lines, perhaps, to help to help the problem where it applies the most importantly in the interactions between healthcare workers and patients. So thank you, everyone. Once again, I'm sad that I am not sitting there with you, but I understand that there's a movement afoot to continue this work through a new action, and I'm happy to contribute where I'm helpful. Thank you again. Congratulations. I'm very grateful to you for helping this concept, which I think seems negative, but which can be viewed as a positive also, understanding that we are all humans, and to do the best job, we need to take care of each other and ourselves. Thank you. Your microphone may be muted there.
Oh, sorry. Yeah, it's working now. Sorry. Well, we appreciate very much your words. We appreciate very much your evaluation and assessment of our modesty work. We are trying in Europe to learn and to spread the word about the impact of the second victims. And I'm sure that we share the same target because we are working for better care in our institution. So thank you so much. Well, we appreciate your words, these splendid words to close our 5th forum, the International Forum. As we say yesterday, some months ago, as you know, because we meet in Baltimore, I tried to explain that we have an application for the course again for a new project. Well, this forum was organized in the past when we started to organize with Marina as well, the local organizing in Serbia. That this is the main objectives is to say bye, but now we are happy because we can say hello again. We have a 1-year project to transfer in a practical sense to the real world our advance in knowledge, in tools, and so on. So thank you so much, Professor Bull, for staying with us during these 4 years. And also we hope that you are involved as well in this new project to spread the word. I would like to show you, maybe Marina, you need a hand to show the video about to introduce the new project. It's less than 1 minute. And we close this last forum just on behalf of the ERNST to say thank you to all the people that connect today with us, and of course all of you that are coming here. Special thanks to our main speaker, Professor Albert Brook from Baltimore, and also Marina and her teams that has the responsibility to organize this excellent forum. So thank you so much, and I hope to see you soon in next activities of our consortium. Marina, if you can connect the video and we can close this forum. Thank you so much.
I'm sharing it on many professionals in healthcare and social care institutions face highly stressful and traumatic situations regularly. Among all these threats include lack of resources, care pressure, fatigue, moral injury, resuscitations, patients not responding to treatment, and systemic failures that can lead to human error. Such situations in clinical practice contribute to burnout, defensive practices, and disillusionment, ultimately putting patients at risk of adverse events. The European Consortium for the Study of the Second Victims Phenomenon, ERNST, through Action 19,113, has extended the concept of the second victim to all professionals and diverse, highly stressful situations to improve patient safety. They emphasize that the emotional well-being of healthcare professionals is a prerequisite for quality care. After 4 years of research, it is time to apply scientific findings to clinical practice. In November 2024, the Cost Innovation Grant 19,113 Rescue will launch, aiming to translate the knowledge from ERNST into daily practice through an innovative formula. This ensures the adequacy and acceptability of second victim support interventions, SVSI, via a pioneering European certification system named Rescue. Rescue enables healthcare institutions and teams to assess the quality of structural and human resources to support healthcare professionals who suffer as second victims after highly stressful events, by ERNST's second victim definition. This is possible through 2 instruments for self-assessment and external audit: second victim support interventions, rescue interventions, trained peer supporters for the psychological and emotional guidance of second victims, rescue supporters. The certification system includes aspects related to the center's safety culture and institutional policies, the second victim experience, the structure and functioning of support interventions, and the competencies that professionals trained to provide emotional and psychological first aid to second victims must have. The rescue program will be developed within a theoretical framework based on ERNST policy statement, the updated SV definition, the 5-tier model, including prevention and self-care as key tiers, a new metric to monitor and ensure the outcomes of this approach. Adaptation to the legal frameworks of each country impacting SV interventions, expanding to primary care and nursing homes. This pioneering certification system will improve the quality of care by reducing avoidable adverse events, defensive practices, detachment, and burnout. To carry out this work, Rescue is organized into 3 working groups. 1. Rescue Maturity Task Force. 2. Rescue Business Plan. 3. Strategic Alliances and Scaling Up. With the launch of Rescue, we aim to increase patient safety and break the vicious cycle of declining care quality, where work stress among health professionals affects their decisions and actions. Addressing this stress is crucial to maintaining high-quality healthcare and ensuring patient safety.
So this is our new challenge. I see you soon working on rescue. So thank you so much. Thank you so much, Albert, for your kind response always and your words today, and to all the people that is collaborating with our network. We have a very good future, and we need your commitment with this new project. Thank you so much for all. Thank you so much, Maria. Thank you. So, Albert, thank you so much. I hope to see you soon.
Oh, thank you so much. You can paste my head into your group photo.
Okay. Good. Okay, thank you so much.
Take care.
Thank you.
Bye-bye. Bye now.
Paul, nice memories. Thanks for the big forum and also for my time.
Thank you.
Bye, thank you.
Bye to you all.
Goodbye.
Bye.
Thank you.
Bye.
Bye-bye.